Good afternoon, my name is Megan. I'm going to be presenting this PowerPoint on the National Opioid Crisis for the MUW Bachelor's of Science in Nursing program. Today we are going to discuss the National Opioid Crisis. At the end of this presentation, any participant will be able to tell us what the National Opioid Crisis is, explain the impact the National Opioid Crisis has on the healthcare industry, list signs and symptoms of opioid abuse, identify the ways the community is combating this national threat, and reinforce how you can make a difference within your community. What is the National Opioid Crisis? The National Opioid Crisis began in the 1990s when pharmaceutical companies were pushing for prescribers to prescribe these opioids and stated that they did not have any negative consequences for taking them. That people would not become addicted to these pain relievers. Health and Human Services declared a public health emergency in 2017. Along with the increased use of prescription opioids, there's also an increased use in heroin and fentanyl. The fentanyl would be illegally made fentanyl. Just some statistics for the National Opioid Crisis. 47,600 people have died from overdosing on opioids. 2.8 million people have had an opioid use disorder in 2018. 10.3 million people misused prescription opioids in 2018. And 808,000 people used heroin in 2018. What are some of the impacts that opioid abuse has on the healthcare industry? Higher bill charges, increased demand for overdose incident treatment, and higher insurance costs. So I want to go back to increasing demand for overdose incident treatment. So this would go if your first responders, they're out serving the community and they're responding to these emergencies. They're having to respond to more opioid abuse situations and overdoses, which doesn't allow for them to respond to people that are in cardiac arrest or experiencing an actual, I don't want to say an actual emergency, but an emergency that is not opioid related. So it's causing our first responders to be at higher demand for opioid abuse and not the cardiac arrest and different situations that they may be in. Some signs and symptoms that you can look out for if you think that someone may be abusing opioids. Changes in sleep habits, drowsiness, lack of hygiene. If you know someone that really fixed up themselves and then all of a sudden it seems like they're letting themselves go and they don't look like they're fixed up anymore, that may be a sign. Weight loss. Some of these drugs, they cause a lot of weight loss. Isolation from your friends and family. If you know someone that has been really outgoing and enjoys being around their family, and then all of a sudden they seem very isolated, they're staying in their room, they don't come out to talk to you, that could be a really big sign for you to look out for. New financial difficulties. If you know someone who it starts to become a lot of debt, they come into a lot of debt. They start asking for money from you, they need help with their bills, that can be something. And if you notice that they're stealing from your friends, from friends, family, or, sorry, that was just the dog. Stealing from friends, family, or businesses, then that's something too, because they need a way to pay for these medications that they're getting to use them. How is the community combating this threat? So some of the things that the community is doing to combat this threat is they are educating the public. There's medication disposal programs, and I'll touch on that in just a second, and then fundraisers that are happening within the community. Something that I didn't know about whenever I was studying about opioid abuse and the national opioid crisis was the medication disposal programs. In the community, there are boxes set up, and they're look in your community and see if they have any. But it's where you can take your unused medications and you can dispose of them properly in that box, so that they aren't in your cabinets for people to get addicted to, or for you to take and become addicted to, and they can just be properly disposed of. The last thing we're going to talk about is how can we make a difference in the community. I think this is a major thing. You can volunteer for a partnership, you can host a fundraiser, you can educate your teenagers at home about opioids and the effects that they do have on people and the family members too. And you can provide support to a friend or family member that you know is struggling with opioid abuse, or maybe they have a family member that is struggling with opioid abuse. So the main thing is just to get involved in your community. Don't be an enabler, but get involved and do these things so that you can make a difference. If we do these things, we can help make a difference in combating the national opioid crisis. Thank you.